Carlton Hall, founder and CEO of Carlton Hall Consulting, or CHC for short. We're one of the leading training and capacity building firms for prevention science and the science of addiction in the United States. When I started CHC, I knew right away that I not only wanted to have an impact domestically in the US, but also internationally. As I traveled around the world, I found out that there were some really important needs that were getting in the way of folks receiving the training well. In countries like Kenya, while it is a magnificent country, it has some very, very critical needs. Many of those needs get in the way of the training that we offer being able to have a real effect and a real impact. And so I made a determination to start a program that might be able to help ameliorate some of those issues, some of those concerns, some of those needs. It's just a small thing, but sometimes small things can have huge effects. I'm here and excited to share with you some of the stories that we were able to find related to two programs, two initiatives that we were able to start here in the country of Kenya. The first is the National Health Insurance Fund, or NHIF Fund. That fund provided resources for more than 116 women to be able to have access for the very first time to life-saving and life-altering health care that they were able to provide not merely to themselves, but also to their family members, the children under 18. This was only made possible through the unique partnerships that we were able to achieve. Partners like the National Authority for the Campaign Against Drug Abuse, or NACADA, and the remarkable CEO, Mr. Okiomo, and Ms. Judy Twala, and her leadership being able to help organize the efforts right here on the ground. And an international NGO in the United States called Women Empowered, who partnered with CHC in order to raise those funds, raise those dollars. So we're going to take you on a little bit of a tour. We partnered with 10 champions across this nation, but I'm only going to share with you stories from Kwale and Mombasa and Nairobi and Matuga as a sampling of what it was that we were able to achieve.
My name is Judith Twala. I work with NACADA. I am the Counseling and Rehabilitation Manager. I have had an opportunity to interact with some of the women, either virtually, on the phone, or even physically. I had an opportunity to visit the Kwale group last year, and it was amazing just listening to their testimonials on how this NHIF sponsorship has changed their lives. They no longer need to worry about how their kids will get medical attention. It is taken care of. And right now they're able to settle and to start small businesses, and they will be able to support their NHIF cover the next year, because this cover expires March 2022, and they assured me that they are prepared to make sure that this program continues, which is growth for women. I think the only gap that I noted, and I'd really humbly request, if CHC plus your other partners and friends can support their children to get quality education, it will be amazing. So that we are supporting these women holistically, not just the medical care, but also their kids getting education, which will help them get opportunities in this country and even beyond, and we will have changed a community.
My name is Farida Rashid Saif, known as Farida Toli. I'm a founder member of Kenya Muslim Women Alliance, and the Kenya Muslim Women Alliance is dealing with women. I empower women, especially those women who are marginalized, especially the Muslim women. They cannot raise up their voices. Most of them have been married and divorced. When they go to Qadhi's office, nobody is there to help them. So I was trying to empower our women as a Muslim women. They should know their rights, and they should know how to raise up their voices. And I would really like now to thank CHC for helping us with health care for our women. It has really helped them. They've been benefited a lot, and they still need to be continued. So in that, I would say that women empowerment is very important for the community. So we need to empower more women, we need to help women and to help one another.
My name is Zainab Salim. I'm from Mombasa, Ganjoni. Nashukuru leo kwa hapa. Naweza kusema nimefurahika kumjua Mama Farida, yuko katika kikundi cha Kenya Muslim Women Alliance. Amenisaidia sana kuempower wanawake, plus nimeshukuru pia CHC ambao imeshirikiana na Mama Farida ikatusaidia na kadi za NHIF, ambao NHIF imetusaidia sahihi. Kama sahihi wakati wa corona hakuna kazi, hatuwezi peleka watoto hospitali. I'm a single mother of 2 kids and nimebenefit sana from hiyo NHIF, na nimefurahi. Namshukuru Mr. Carlton na CHC. Ningeomba watuendelezee hii program ili tuzidi kupata usaidizi, manake hali imekuwa ya uchumi ni ngumu, na kama as a single mother ni ngumu sana kupata usaidizi. So I'm glad and I thank the team of CHC.
Kwa majina naitwa Nora Kapue Mwang'ombe. Mimi ni mkaaji wa hapa Ganjoni na nimeishi hapa Ganjoni kwa siku nyingi sana. Mimi ni mama lakini mjane. Niko na watoto 4. Niko na wavulana 2 na wasichana 2. Nashukuru Mungu. Na nashukuru pia kwa sababu hali zimekuwa ni ngumu, lakini tumekuwa tuking'ang'ana na maisha na hizi biashara ndogo ndogo. Tumeng'ang'ana na watoto wamesoma. Hizi biashara ndogo tumestruggle na tumefaulu, tunashukuru. Katika hii hali ya matibabu tumekuwa tukiwa wagonjwa, lakini tukawa tunatumia pesa nyingi sana kwa hospitali. Sasa unapata tu umekuwa mgonjwa, inabidi ukae tu bila kwenda hospitali kwa sababu huna pesa. Ama sasa umekuwa mgonjwa, unaenda unanunua dawa chemist. Dawa dozen ya kama tembe 10, unanunua tembe 1 leo, kesho. Yani matibabu yamekuwa ni shida. Upate matibabu ya sawa sawa. Kuna mali unasikia unaumwa, unaenda hospitalini, pesa zatikana nyingi za picha, unasema wacha ikae. Katika hizi hali ngumu, hata mimi kusema ile ukweli nilikuwa nikitamani sana, nilikuwa nikitamani sana nione NHIF kwa miaka mingi sana. Nilijaribu, kuna siku nilienda hapo kwa hiyo ofisi, wakaniambia sijui 1500, nikamwambia narudi, sikurudi tena huko. Nikakaa ndio hapa juzi hapa nikaja nikapata hizo habari kupitia Mama Farida. Nikaja hapa, kajaza majina. Nikaona kama labda ni mchezo, lakini haikuwa mchezo kweli. Baada kama siku kadhaa hivi akanipigia simu akaniambia, mama njoo ofisini uchukue NHIF. Mimi siku nilikuja kuchukua NHIF nilifurahi sana. Nilitamani sana kuona NHIF. Na kutoka nimepata hiyo NHIF, nashukuru. Nikiwa mgonjwa naenda hospitali nzuri sana, natibiwa, situmii hata shilingi.
It's one thing to have an idea, to understand that you're going to do something that might be of great benefit. It is another thing entirely to hear from those women directly, to understand just how impactful this initiative actually was to them personally. I was in awe of the stories that they shared with me. I hope you will feel the exact same way when you hear from them as well.
My name is Jane Nyaga. I am a nutrition consultant. I'm also the president Matuga Community and the Drugs Coalition. And in the community, we have been facing various challenges, especially with the drug use. Also, you had children missing school due to the fact that at times they are sick and the family could not afford medical care. So when we got Carlton Hall consulting firm with NACADA coming in to assist, we identified 19 families that were suffering due to the fact that they were lacking medical care. The 19 households were identified based on their ability to provide for themselves. We identified out of them, 10 of them were widows who were left behind by their spouses and they had children who were in school. Some others, and we had one who has a child who has a terminal illness, so that child requires medical assistance all through.
and others were because of the fact that they lost jobs and some did not have anything to sustain themselves.
Kwa majina naitwa Mehaji Ramadhani. Mimi ni mkazi wa Tiwi, Kwale County. Mimi ni mama na mtoto mmoja. Na nashukuru kwa shirika la CHC kutuletea bima NHIF. Imetusaidia especially kiupande wangu. At first mtoto alikuwa akigonjeka, naona ukienda sometimes government hospital, mtoto umeenda naye wamuona yuko serious, ukifika unapewa Panadol, hapati matibabu mazuri. Sometimes ukifika wapata kuna trainees, na ukijaribu kuelezea hali ya mtoto anakupea tu Panadol, ukirudi nyumbani bado na shida iko pale pale. Lakini na hii card saizi hospitali yangu ni Kinondo, na nashukuru Kinondo nikifika mimi mwenyewe nahudumiwa vizuri, msichana wangu anahudumiwa vizuri. So nashukuru sana kwa hilo.
We have women whose husbands were just abducted, taken away. Either they were killed or they are just lost for years. Such women, they neither know that they are widows or they have husbands. Their children, they are neither orphans nor children with their fathers. There's a very difficult situation in them. So with this assistance, it has given a very big help, and they are so much thankful for this. And if it can be continued, then I think it will be a very helpful. It should also be expanded, because so far we have given only 16 women, but there are more who are in need of such help. And it's not only the health help, they also need economic assistance, because there's some who need something to push them forward. Like in my organization, I have so many requests. I have requests for tailoring machines, I have requests for refrigerators, I have requests for at least something to make them push their lives together.
Naitwa Katiba Mkungu, ni mkaazi wa kaunti ya Kwale, Msambweni sub-county. Mimi ni mwenyekiti wa jopo linalosimamia masala ya madawa ya kulevya yanayofanya kazi ya prevention kata ndogo ama sub-county ya Msambweni. Kwanza ningependa kutoa shukrani zangu za dhati kwa ndugu yangu Carlton Hall kwa pale alivyotuchukua, kutulea na kutufikisha pale alipotufikisha mpaka dakika hii au mpaka muda huu. Pili, ningependa kushukuru sana NACADA kwa ushirikiano wao pamoja na Women Empowerment kutoka Amerika, ambao walisababishwa na ndugu Carlton kufika Kenya, kwa msaada ambao wameipatia jamii ya kuwasaidia kupata huduma ya afya. Hili ni jambo ambalo lilikuwa ni jambo sugu katika jamii nzima, kwa sababu ya uwezo wa jamii na hali ya matibabu yalikuwa ya juu sana. Gharama za matibabu zilikuwa juu sana. Kwa hivyo watu wengi walikuwa wakiumia, wakipata shida, wakidhalilika, wakipata matatizo juu ya swala la kuweza kupata matibabu bora. Mradi huu ulivyokuja kupitia ushirikiano wa makundi haya matatu pamoja nasi huku chini mashinani, umeweza kutupatia natija kubwa, umeweza kupatia jamii natija kubwa. Kwa hivyo ni ombi langu mimi kama mwenyekiti kwamba huu mradi usiachiliwe. It is very dear, it is a dear program, and we embrace it. Na tunaomba kwa vyovyote itakavyokuwa, wajitahidi, tujitahidi, tushirikiane, tuhakikishe huu mradi tunaweza kuuendeleza na kuusogeza mbele, na ikiwezekana pia watu wengi wenye mahitaji na wenye matatizo ya aina hiyo waweze kusaidika.
The second initiative is an initiative called the Youth Global Scholars Program that we started at CHC. The intent of this program is to identify promising young people who, other than the fact that they did not have the resources, are not matriculating in school. And so we started a campaign in order to be able to provide resources that are necessary for them to go through their schooling. But we found that we couldn't just provide the resources for their school, but many of them lack some very, very basic needs, like being able to have food to eat and make sure that they're able to go to school and being supported well as they're going through school. So we partnered with an extraordinary individual, extraordinary champion, a friend of ours, Mr. Giorgio Ching from Koro Gojo, and his organization, Slum Child Foundation, to be able to identify some promising young people to be able to do this program. You're going to meet a wonderful young woman named Shaniza, who will be able to tell her story. And we had a chance to meet with her mother as well. And you'll be able to see that these are young people that are extraordinarily promising, full of life and vigor, should be able to have no limits at all, had it not been for the fact that they didn't have access to proper education. And so through the support of our Scholars Program, they're now able to matriculate well in school.
So my name is George Ochieng. I'm the founder and director at Slum Child Foundation. Slum Child Foundation is a charitable children organization working with children in the slums of Koro Gojo in Nairobi, Kenya. We work with women, children and youth, and we have a broad or a range of programs that we do with them, including a scholarship program. And I'm very, very much grateful to Carlton Hall Consultancy for the partnership we've had with them, and they've been of great help. So far we have 2 children who have been supported to go to school. A young girl called Shaniza, she's in school at the moment, and we are very much grateful because the mother comes from a family that is not able. The mother used to brew illicit alcohol to be able to support the girl. And we are very much happy for CHC because out of the good support, the mother has been able to transform and look for other things that she can do to be able to support the family. And CHC is now providing the scholarship.
My name is Shaniza Njeru. I'm 15 years old. I am currently in Form 1 in Roraka High School. I'm the firstborn in a family of 3 members. I have 2 younger sisters. My mother's name is Tirisia Wanja, and she's the breadwinner of the family. I am a beneficiary of CHC Global Youth Prevention Scholars Initiative. This scholarship has helped me and my family, especially my mom. Since she's the breadwinner of the family, the money that she was using to pay my fees is now going to my siblings and the bills of the house. Apart from finishing my studies, my dream is to become a professional fashion designer. This has been my passion from when I was a small girl. And when I'm in high school, I hope that I will be able to learn more. I believe the scholarship will help me achieve my dreams, but not only for me, but other younger girls who are out there. I want to thank Mr. Carlton for helping me throughout with the scholarship, and may God bless him abundantly. Thank you.
I learned 3 very, very important things as I heard all of their stories. I learned, number 1, that the need is greater than I thought it was. Secondly, I learned that the benefits far exceeded our expectations. And lastly, I understand that this program cannot end here, but it has to be continued, even expanded if we could. And that's why we're bringing these stories to you. None of this is possible without your help. Every year, CHC has a fundraising campaign in which we entitle Such As I Have. It was actually based on a biblical story that I heard as a child where Peter said, "Silver and gold have I none, but such as I have I offer to you." It really means that no donation is too small. In fact, on this tour that we had during this trip, we found out that our small efforts really had impacts that far exceeded our expectations. So I implore you, go to our website, www.carltonhallconsulting.com, and find out how you can help support our efforts to find inspiring solutions to produce a better world. We look forward to partnering with you.